And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna here at Clear Chiropractic. Today we are talking about trigeminal neuralgia. Pain, and I mean bad pain on the face. Talking about a new research article that's come out saying that for certain cases, look to the neck. So please share this video if you've got anybody in your family who's experienced this. This is one of the most painful conditions known to humankind. Let's jump into it and explain, what does your neck have to do with pain on the face? Okay, now this is actually a surgery article, but we'll cycle back because it may not always involve surgery. This one hot off of the presses. Trigeminal neuralgia as a presentation of high cervical stenosis, a systematic review of the literature. So an atypical presentation of cervical spondylopathy, degenerative arthritis, trigeminal neuralgia is attributed to the extension of the trigeminal nuclei into the spinal cord and is frequently overlooked, leading to limited discussion with patients regarding potential anterior cervical surgery. And I'll explain what that means in just a sec because it's easier with pictures, but in a nutshell, the nerves that are responsible for processing information on the face, they actually descend down into the upper part of the neck. And if there's a problem there, it can create a transmission error where what we feel is pain on the face. What these guys did was they had a look at a series of studies that had been done for people. And they found that predominant levels of compression were at the level of C2, C3, and C3 and C4. So not at the very top, but just a couple of levels down in the neck. But after the surgery, and it was 30% of the patients there, 100% experienced immediate resolution of trigeminal neuralgia with no return at an average 7-month follow-up. So they are concluding that a high-level stenosis can produce trigeminal neuralgia, and surgeons, again this is a surgery article, should raise the possibility of cervical spine involvement when counseling patients with this disease. Okay, now let's dissect that a little bit here. What I've got is a fun little picture where you can see the brain, and highlighted in the green here, these are going to be the branches of the trigeminal nerves and also the nuclei, which are the processing centers for sensory information on the face, but also the head and the upper part of your neck right here. So the trigeminal nerve proper is made up of 3 branches. So V1 is what's called the ophthalmic division. It's what's responsible for this area around the eye. V2, this is the maxillary division. So this is going to be like your cheek and the upper part of your palate. And then you've got V3. This is going to be the mandibular division, which is the lower part of your jaw. And this is also the guy that's responsible for how your jaw is actually able to move. Now, as you can see, these trigeminal nerves are located way deep inside of the skull. But the processing centers that collects all of these information, it actually descends all the way down into the upper part of the spinal canal at the level of a C1, a C2, a C3, and a C4. And we've seen this in upper cervical chiropractic for years and years. So it's awesome that the surgeons are recognizing, hey, you can actually have a problem going on in this area of the spine. And what will happen, it's a process that's called a disafferentation. Short of it is if you've got abnormal or pain signals coming from the joints in the upper neck, they're going to go into that exact same processing center within the brain. And the kicker is that if you have a crisscrossed message, kind of like a wire where the signal does not go to the right area, your brain can end up perceiving that the pain is actually located here, when in reality it's coming from somewhere else. Now, the researchers, they also used a fancy word called a stenosis. Stenosis, simply put, means narrowing. What I've got here is a giant model of essentially the head, and then this is from the back side, the top vertebra in your neck, the C2, and then you can imagine where the rest of the vertebra would be sitting below that. Now what you've got is you've got this opening right here. So this is where your spinal cord lives. Stenosis then is where you can have narrowing like this. So you would imagine I'd stick my fingers into this spot right here, and something is going to be causing irritation of that particular area of the nerves, but more importantly of the fluid that's on the inside. And I can jump over to this little animation to show you what we're talking about here. So we're looking now kind of at a top-down view of what I had just shown you with that top vertebra in the neck. So the C1, the C2 located right here, and then the spinal cord sitting right here. So whether you've got either a degenerative arthritis or if you've had some kind of a physical injury that affects the way that these joints align, the way that they move, the stability of the ligaments, what it can do is it can start to create tension in this particular area. And when you have tension on the ligaments, that can start to affect circulation inside of the head. And as a result, we start to have downstream effects, but also upstream effects. Now, one of the things that I want to point out in this particular illustration here, because sometimes people think, oh, what the problem is that either the cord itself or the nerves, that something is getting compressed, something is getting crushed along those lines. That is not what happens. If you've ever got like direct compression on your spinal cord, you're dealing with a whole bunch more problems besides just a neuralgia. You're dealing with paraplegia, quadriplegia, different kind of things like that. So no, we're talking about something more that's producing tension and producing irritation. When that happens, that, like I had mentioned, can start to affect circulation. Even though it's in this area, because this is also the area that's responsible for draining fluid from the brain, you can have a pooling backward that starts to affect the brain in lots of different areas. So common examples are going to be headaches, migraines, dizziness, brain fog, blurry eyes, but you can also experience neuralgia as well. And a trigeminal neuralgia, truth is, it is a severe enough and painful enough condition that if a person was told your only option is surgery, yeah, they're going to do it because it's that severe. I don't envy anybody who's ever experienced this at any point in their life. And there are certain kinds of surgical procedures that are going to be very, very beneficial for people who experience trigeminal neuralgia. One of them is what's known as a microvascular decompression. Short of it is a person's had an MRI, and what you see that the trigeminal branches are sitting in near proximity to a few of the arteries. Usually it's a branch which is known as the superior cerebellar artery. But the point is that when that artery is actually pumping blood, the two of those guys are oscillating against each other and it's producing friction, a rubbing, and that's what's producing the symptoms here. If that's the case, a microvascular decompression, it is a relatively uncomplicated surgery that has an excellent track record. I mean, people get huge benefit from that. But for a huge amount of people who experience neuralgia, they have the MRI and there's no sign of this friction here whatsoever. So this is the important thing for those particular kinds of people who are watching this video. If you have had an MRI and there is no sign of irritation of the nerve or of the arteries inside of the brain, the problem instead could be coming from lower down, and it's one of these transmission errors coming from your neck. Now again, when the symptoms are severe enough, yeah, people might say, whatever it takes. If I need neck surgery, so be it. But my point here is that there are oftentimes more or less, there are more conservative, less invasive ways of addressing that. Yes, if you're dealing with gross instabilities, you might need a cervical fusion. But for many people, it doesn't have to come to that. The problem is that at some point in the past, there was a physical injury. No broken bones, no bleeding, not even any bruising on the outside, but there was damage on the inside that ended up affecting the way that these guys are able to move. If we can then identify this is the location that's producing that stenosis, that narrowing, and super duper common at C1 and C2, if we can identify where that is and make sure then that we're going to be delivering a tailored and a very precise and very gentle correction to help restore that normal function, that normal mobility, what that has the potential to do is that releases the tension to the system. It means that the area can start calming down. It means that the circulation can start flowing the way that it should, and we can start seeing people, even when they're experiencing facial pain, get a lot better from making an adjustment for the neck. So whether it's for yourself, friend, family member, client, colleague, if somebody you know has been diagnosed with trigeminal neuralgia, they've had the brain MRI, you know that you're not dealing with something inside of the skull, no lesions, no tumors, no infections, no rubbing or anything like that, then upper cervical care might be a natural alternative solution to help get that quality of life back. So thank you guys for watching this video. If you've enjoyed this one, please do make sure that you click that like and subscribe button so that the algorithm finds it, so that this information, simply put, can be available for other people who are looking for solutions. You can also go over to our clinic website, which is Clear Chiro Spokane, where we've got links to all other blog articles, videos just like this one, where you can find out how is it that the treatment works, how would we be able to help you out. Thanks for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.